Low blood pressure is a reading below 90/60ths of a millimeter of mercury. Many problems can cause low blood pressure. What causes low blood pressure? Low blood pressure can occur for a variety of reasons. Causes of low blood pressure include 1. Orthostatic hypotension. This occurs when you stand up too quickly and your body is unable to provide more blood flow to the brain. 2. Temperature extremes. Being too hot or too cold can affect low blood pressure and make its effects worse. 3. Central nervous system disorders. Disorders such as Parkinson's disease can affect how the nervous system regulates blood pressure. People with this condition may feel the effects of low blood pressure after eating because their digestive system uses more blood to digest food. 4. Low blood volume. Blood loss from a serious injury can cause low blood pressure. Dehydration can also cause low blood volume. 5. Pregnancy. Orthostatic hypotension may occur during the first and second trimesters of pregnancy. Bleeding or other pregnancy complications can also cause low blood pressure. 6. Life-threatening conditions. These conditions include irregular heartbeat, arrhythmia, pulmonary embolism, PE, heart attack, and collapsed lung. A life-threatening allergic reaction, anaphylaxis, or an immune response to a serious infection, sepsis, can also cause low blood pressure. 7. Heart and lung conditions. If your heart beats too fast or slow or your lungs do not work properly, you may have low blood pressure. Advanced heart failure, weak heart muscle, is another cause. 8. Prescription medications. Use of medications to treat conditions such as high blood pressure, heart failure, erectile dysfunction, neurological problems, or depression may cause low blood pressure. Do not stop taking prescription medications unless your healthcare provider tells you to stop. 9. Alcohol or recreational drugs. Recreational drugs can lower blood pressure, for a short period of time, just like alcohol. Certain herbal supplements, vitamins, or home remedies may also lower blood pressure. That's why you should always include these details when you tell your healthcare provider what medications you are taking. What is low blood pressure? Low blood pressure is less than 90/60ths of a millimeter of mercury. Normal blood pressure is higher, up to 120/80ths of a millimeter of mercury. How common is low blood pressure? Because low blood pressure often occurs without symptoms, it is impossible to know how many people it affects. However, orthostatic hypotension seems to become increasingly common as people age. About 5% of people over the age of 50 have this condition, and the figure rises to more than 30% over the age of 70. Who does low blood pressure affect? Low blood pressure can affect people of all ages and backgrounds, depending on what causes it. However, it is more likely to cause symptoms, particularly orthostatic hypotension, in people over 50 years of age. It can occur, without symptoms, even in very physically active people, and it is more common in younger people. Our suggestion: if low blood pressure is suspected, diagnosis and treatment are essential. With proper diagnosis and treatment, falls and other complications can be prevented. Fortunately, this condition is often treatable, and there are many things your healthcare provider can explain to help you take care of yourself.